Real Country 1430 AM and 107.3 FM WRD. And Brian Winnekins. And joining us this afternoon is Pepin County Health Officer Heidi Stewart. Get an update on the COVID-19 situation. Also, I know that there's flu vaccinations coming up and all the other good things. And Heidi, thanks for joining us. And Heidi, I guess I'm going to actually start with the flu here. Earlier on Thursday, you had the health department at its first flu clinic.
Well, it's actually not our first, Brian. It was actually our last.
Oh, wow.
So yeah, so each year we're able to secure the influenza vaccine for the school-age children, actually 18 and under, through our Vaccine for Children program, as well as our preparedness program. So we do it kind of in a mass clinic style, and we've done that influenza clinic that way at the schools for a long time. And that experience helped us when we had to do the COVID mass clinics. So we kind of had an idea of how flow would go and things we needed to have in place. So this was really kind of simple today when we did this amount, and it was possibly the smoothest running influenza vaccine clinic that we've done at the schools. They always go very well. The help from the school there is wonderful. I know all schools have support staff that help a lot with these things, and they do a lot of work beforehand. So I want to tell them all thank you for the work they do behind the scenes. But yeah, so we completed the Pepin school influenza clinics on the 15th. And then last week we completed the Assumption schools, and this week we completed the Durand, Arkansas school district. I would say that our influenza numbers, the uptake of the influenza vaccine, both the nasal and the injectable, are down a little bit, which I don't know all the reasons for it, but it's understandable if somebody is following the influenza case numbers. So influenza continues to be fairly flatlined as far as cases in our county, in our state, in our nation. Influenza numbers continue to be very, very low this year, much like they were last year.
Now I have to ask, because I remember this as a child, elementary school, kindergarten. I still remember it to this day. Douglas MacArthur Elementary School. We're all lined up, and there's this lady with this big giant gun zapping all of us. It was for the polio vaccine, I think, and some of those other it was like more of a vaccination thing. That was like frightening with that gun deal. You don't do that anymore, do you?
We don't. We try to be, as welcoming and as soothing as possible. In the past, we've had grants where we've been able to offer them stickers and books, and with COVID still lingering out there, the goal was to get in, provide the vaccine, the influenza vaccine, and get out as quickly as possible. So
that was, I mean, I'm just saying that was,
yeah,
big old giant gun on there, and it's like, I'm,
yeah,
already afraid of needles, and it's like, okay, they weren't as friendly, I don't think, as you guys are, because one held me down and held my arm out, the other one zapped me, and then they just let me go to run.
I can tell you that I've been here for 15 years, and back at the beginning of that, if a parent filled out their form and they wanted their child vaccinated, we did hold kids down and provide that vaccine. And sometimes we have to do that here when the parent brings them, but the parent's with. So we actually changed that policy a while back. We don't do that. If the kid is scared or anxious, we do everything we can do. Today we had a youngster that was a little bit anxious. We encouraged him, maybe call his mom, see if she could come and do it with him. He got off the phone. He thanked his mom for giving him the confidence. He came in, sat down like a trooper, and took his vaccine without any issues. I think that the public in general would be amazed at how tough some of these kids are. They come in, they have no concerns. They watch the needle the whole time. and they walk out. And what's one of the most, it just feels good. And you know that we're raising good kids when a good portion of them, after you give them their shot and they leave, they say, thank you. Yeah, you're welcome. No problem. So we're doing a good job raising some very polite kids and gracious kids here in our communities.
I'm still traumatized from just getting my booster and flu shot. Poor Charlie. I think he, we're at Heike's. I think he was just like, really, Brian, you're this, you have to look away that bad. Yeah, I'm an old guy and I'm still afraid of needles, all because of what happened when I was 5 years old, because I still remember that big giant gun. I still remember that big giant gun they held and they just zapped you with it really fast. But anyway, let's talk about COVID numbers right now. It's kind of, I've seen, research papers and stories about how this seems to go like in 2-month cycles, and where we have a big jump and then all of a sudden 2 months we have a big drop. And it seems like we're kind of in the process of doing the big drop.
Yeah, it would seem like we're that surfer on the backside of the wave where it's coming back down. If you look at the CDC data tracker, it'll continue to tell you that our community transmission level is high. I can tell you that if I look at our daily numbers that come in, some days we have one, more frequently we have between 2 and 4 cases per day. If I just recently looked before this broadcast, I looked at our 7-day, the last 7 days, and we've had 17 cases in the last 7 days. So we do continue to have cases, 2 hospitalizations in the last 20 days. So that is good. The vaccine is doing its job at preventing those hospitalizations, and we haven't had any deaths since the last time I believe we spoke. So our county total is still at 10 deaths.
And I know that with kind of the while we're still having cases, it's starting to drop a little bit, like Pepin schools, they, with their metric system that they use for what they're doing, they kind of dropped a level.
They did. And I can actually show you some of the data and some of the ways that they're measuring that. The Wisconsin Department of Health Services has come out with a lot of different ways to look at the data. And one of the ways that you can look at the data is actually, excuse me, I'm sorry. One of the ways you can look at the data is actually by school district. So as Pepin looks at what their numbers are and where they're at in their metric, if you can see the document I'm sharing here, it shows their total cumulative cases. And this isn't just for the specific district. This is for all of the people that live in those district boundaries. So it's not the Pepin school district. It's not the kids. It's not the teachers there. It's everybody who lives in that community. So there's been one new positive in the last 7 days one new positive. Maybe that's today. I'm not 100% sure, but their 7-day average is 0.29 cases. So that's pretty impressive for a community in general to be that low. And if you look at the other school districts that are throughout our county, Durand numbers aren't that different. They're bigger. The whole community in general is bigger. So they're at 2.29 cases per day. And that's the community. That's not just the school. It's using the school boundaries. And then we do also have people who reside in the Mondovi School District, and their 7-day average in the Mondovi School District boundaries is 5. Now, I think what we're seeing in general over the last while, and Jesse, the public health nurse that does most of our contact tracing and disease investigation, once it's hitting a household, it's going through the whole household. So that's staying pretty true. Pepin did implement down in there. I can go ahead and stop sharing that. Pepin did implement their metric system. They were at a certain level that meant masks. Now I believe they've stepped down where masks are just recommended. So their case numbers led them to make that change.
Meanwhile, the Department of Health Services has some new, I guess, things on the website that people can use if they want to follow along, and kind of if they're maybe going to a playoff game,
Yep.
or if they're going to, some type of other school event, they can kind of follow this from the Department of Health Services. Tell us about that.
So that's I'm going to go ahead and share again. This is kind of what I'm talking about. The map that I just showed you was on the Department of Health Services website. If you go under COVID and you go under county information, this is an example of something that you can download. So if you were, going to travel, and this is available for everywhere in the state of Wisconsin, if you're going to travel to a specific vicinity, you can look at their vaccination percentage rates. So here is a snapshot of by our townships in Pepin County, our vaccination rates. Some of the townships are better. Some of the townships are a little bit less. It looks like the only township that we have that is above 70% vaccinated would be the Stockholm Township, and then followed by some of the others. So the information is out there if you're really interested in looking at vaccination rates. If you're interested in looking at, you can also look by township, or you can look by zip code or school district boundaries. You can look at the case numbers. You can look at the vaccination rates. There's lots of information out there now.
Talking with Pepin County Health Officer Heidi Stewart this afternoon. Heidi, I know with the boosters, we have, I know the Pfizer one, and I think Moderna, and now even Johnson & Johnson, they're all kind of available. So if people are wanting to get that, they should contact their provider, right? Or can they contact your office if your office is doing that?
Yep, I think I'm sharing the wrong screen. Just a minute here. Let me share yet another screen. We do have the COVID-19 vaccines, the Pfizer and the Moderna available. We got our shipment of Moderna in yesterday. So we are able to do the primary series for those. We're also able to do boosters for those. At this time, we don't have the Johnson. I don't think am I sharing the vaccine booster screen?
Yes, you are.
Okay, good, thanks. Right now, we do not have the Johnson & Johnson vaccine, but the good news is that you can mix and match these vaccines. So if you received the one-dose Johnson & Johnson early on, and you really want to get a booster, you don't have access to a Johnson & Johnson booster, you can come to the local health department, you can come to Heidi Pharmacy, you can most likely go to one of the local providers here, and you can get either the Pfizer or the Moderna vaccine.
Now, if there's folks out there that may have received Johnson & Johnson on the advice of their physician because of potential reactions because they have other medical conditions, and should they really maybe go back to their medical provider then first and say, for this booster, should I stay with that because I have other allergies or conditions that taking Pfizer and Moderna may not be a good idea?
So we will always encourage people to consult with their primary physician or a physician that is familiar with their specific case prior to making any decisions about a vaccine. So if you consulted with your physician early on and they told you that, the Pfizer was the right one for you, or the Moderna was the right one for you, or the Johnson & Johnson was the right one for you, for whatever reason, go ahead and stick with that same vaccine, or reach back out to them and find out if they have a preference for you.
Now, with the with the other part with the vaccines, we're getting more younger kids are going to be able to get this potentially. There's been some approval. When that is done from FDA and CDC and all that, when would that be available then to the younger kids here in Pepin County? Will you have to wait for something from the Wisconsin Department of Health Services, kind of like what you had to do with the boosters?
Yeah, so DHS is actually working to get out in front of this approval that is pending. They have taken the primary orders from health departments for the vaccine for the 5 to 11-year-old age group. That is going to actually be coming to health departments at the end of this week, at the beginning of next week. We cannot use that vaccine until we get the final go ahead from them and we see the clinical guidelines come out from them. But it is definitely something that we are going to be able to provide as quickly as it is possibly approved. So November 3rd is a date that have been encouraged to watch for potentially the vaccine being finalized and approved. And then I would assume it will take DHS a day or so to get us those clinical guidelines and then give us the go ahead to do that. I know that we have done influenza vaccines in the schools in the past, and that would be the same age group and we did them today, and this would be the same age group. But at this point, we're not planning on going to the schools to do the mass clinics with the COVID-19 vaccine. So we're encouraging parents that would like their children to receive this vaccine to follow our Facebook page, call the health department after that November 3rd date, and we can get something scheduled. We're going to most likely be doing those vaccines out of here or possibly a community clinic at some location. So that if there is concerns that the parents have, that they can be present with their child for that vaccine. It's different than the influenza vaccines that we've been doing for years and years.
Sure. All right. Well, Heidi, again, as always, we appreciate you joining us today.
Thanks, Brian. And I'm going to give a shout out to all the Panther and Eagle teams and the Buffaloes as they move forward in playoffs. So good luck, everybody.
Heidi Stewart, Pepin County Health Officer, and you're listening to Real Country 1430 AM and 107.3 FM WRDN.